The Coalition to End Homelessness is a group of NGOs based in Cape Town fighting the scourge of homelessness. The NGOs have teamed up to find ways to alleviate the burden of homelessness on the economy and the pressure it builds in local businesses and properties. U-Turn and MES and Khulisa Streetscapes have conducted a study that shows that the population of over 14,000 homeless people cost the city of Cape Town in the region of 744 million rand last year, with the number seemingly rising exponentially with the cost of the COVID-19 relief fund included for this year. To talk to us more about this study and its findings, we are joined via Zoom by U-Turn Director Sam Vos. Sam, a very good morning to you. Thanks for joining us.
Good morning, Desiree. Thank you for having me.
Tell us about U-Turn and what they seek to achieve in society.
So we're a non-profit that helps homeless people to overcome the challenges of homelessness by equipping them with skills and work opportunities so that people can leave the streets and become long-term independent.
Yeah. And then now let's talk about the study. How does the study seek to relax the pressure homelessness puts on the economy?
So the study was a fascinating exercise, and we were very pleased to be the first in Africa to undertake a study like this. Obviously, it's been done elsewhere in the world to great effect. But what the study just highlighted is how much money is spent annually on homelessness, because many people are unaware of the hidden costs of homelessness, the cost to the security sector, the cost to law enforcement, and the compassion of ordinary citizens. And so the study just served to highlight that we're spending a lot more on homelessness than we think we are. And the study essentially calls to say, can we not get a better result if we direct our funding a little bit more towards developmental practices, but just highlighting the huge cost that homelessness is on our city. And these were all pre-COVID numbers. We all know that during COVID or as a result of COVID, the number of homeless people have increased.
The study also found that the deterioration of the physical and mental capacity of the homelessness, or rather the homeless, weighs heavily on local economies. How does that impact the whole supply chain of a local economy?
Yes, in the study we showed that the average duration that a homeless person has spent on the street is 8 years and 7 months. And the cost per month when a person is on the street is 4,300 Rand per month. And that's a huge cost. It's a huge, huge cost. So we are just highlighting that if we could create better pathways out of the streets, people would not be on the streets for that long. Just to give you a comparative, we found that approximately 50% of the Cape Town homeless population are chronic homeless individuals, where they've been on the streets either multiple times or more than 1 year, or 1 year plus serious mental health and substance abuse conditions. And that's the international definition of what does it mean to be a chronic homeless person. And shockingly or alarmingly, shall I say, in Cape Town, we're finding that 50% of the homeless population counts as chronic homeless. And just by comparison, in America, that number would be 24%. And in other developed countries, that number is much lower even than that. So it shows us that there's just been this long-term underinvestment into the homeless sector, meaning that people that end up on the street stay on the street. And if they become chronic homeless, it becomes even more difficult to treat that individual or to help that individual turn their life around. So there's an urgent need for us to create better exit strategies, better methods to essentially help people to leave the streets.
In this 4,300 rands per month cost that you spoke about, how do you break it down, and also who bears this cost? Because it can't be government, because the assumption is that if this person is on the street, government is not providing them with any service.
Yes, so what happens is that 4,300 per person per month breaks down as 45% goes to costs that we classified as reactive or even punitive. In other words, the criminal justice costs of arresting someone, keeping them in a police cell, letting them go to court, and then imprisoning where that is required, or releasing on parole where that is required. That was the reactive punitive cost, and it accounted for 45% of the overall contribution.
Yeah.
Then the next biggest contribution comes from the humanitarian and compassionate response, essentially coming directly from the public. So we found that the public do support homeless people. We all know that when a person asks us for help, our heart goes out to someone who's suffering like this. So we were able to quantify that support, and the support directly from the public to a homeless person amounts to approximately 55 rand per day. And overall, that constituted 39% of the total cost of homelessness. And then, alarmingly, the smallest percentage of costs were actually expended by expenditure going directly to service providers such as U-Turn or the Department of Social Development, both the city and the provincial. Those amounted for about 16% of the costs. And so we see between these three camps, the humanitarian spend, where it's the compassionate support from the public, the reactive and punitive expenditure, and the developmental expenditure, it makes for that alarmingly high figure. And this is the whole purpose of the study, is to highlight that there's far more costs being incurred by all of us than what we might have realized.
How does the severe impact of COVID-19 exacerbate the already bleeding economies of developing countries, especially South Africa?
So we have certainly seen in Cape Town a marked increase in the amount of homeless people on the streets. We have seen at our service center, we run multiple service centers in the city, and we have seen there's been, initially when lockdown hit, there was like a 60% increase in the demand for services at our service centers. By July, we had served as many meals as we had served in the entire 2019. And that pressure over time dissipated a little bit as COVID lockdown levels eased and people were able to draw support from the public again. But we have definitely seen, even now as we stand at the end of the year, the overall number of homeless people on the street and the demand on the service providers. And this was witnessed not just by U-Turn, by our partners in the coalition. They all reported the same findings. There's just been this significant increase. And I think, we can expect that if so many people have lost their jobs, as we know in the public media, sooner or later, with people with no income and perhaps no reserves to fall on, there are going to be more people that are on the street.
Sam, you can correct me here if I'm wrong. I've never seen a study on the cost of the burden of homelessness. I don't know if that's a groundbreaking study or if there have been others previously like it. What kind of factors do you consider as you consider your assumptions going into this kind of research?
Yes, it's not the first time that a study like this was done in the world. In fact, as we started considering doing a study like this, we found we went and searched globally to see what is best practice when trying to calculate the cost of homelessness. There's been studies in Canada, in places like England did in multiple studies, Australia. So all of these different locations have done specific studies like that. And we then examined the methodology used in each one of those. And then you contextualize it to your local setting. And so we had to work out exactly how many homeless people there are, had to work out what elements we will include. And this figure of 744 million in total, we are saying that we are actually spending in excess of that. Because, for instance, a large cost element that we could not calculate was the medical costs going to homeless people, because we couldn't find a way to isolate the medical expenditure specific to homeless people. We were able to isolate the support from the public, as I've explained. We were able to isolate the support or the legal and criminal expenditure on homelessness, and also the developmental aspects. So we surveyed all of the non-profits that are working with homeless people. We asked and got input from the city and the provincial departments explaining how much they are spending on it. So it was a very, very thorough and robust study. And we know that if we were to add the medical cost, if we were able to find a way to identify and isolate the expenditure specifically on medical costs, we would be able to show that it's even more than 744 million. And our call is really to channel more of that expenditure to developmental practices, which ultimately reduces homelessness and reduces the dependency that people have, so that we can increase everyone's resilience. That is our heart's desire.
How realistic is it, the quest to end homelessness?
I firmly believe it is thoroughly possible. I believe that if we can channel, just to show the specifics, we are spending a mere 120 million on developmental practices per year, and the public support to the homeless is more than double that, 286 million. And so if we can channel some of that 286 million to go into developmental practices, I firmly believe we can create new services, we can create better ways and more coordinated ways for us to engage with the issues of homelessness, and we can see results much faster. If we consider the fact that if you leave a person on the street, it costs you 4,300 Rand per month, and the average duration on the street is 8 years and 7 months. So with those kind of costs, it makes far more sense to send someone, for instance, on the U-turn rehabilitation journey, which costs 6,000 Rand and takes 2 years to render people completely employed, stable, and sober. So we see that there's much better ways to secure long-term outcomes. And we are really excited that by doing this study, we can make everyone reconsider how effective is their intervention and the form of support that they are showing.
It's been an absolute pleasure talking to you. Would love to talk some more, but obviously with live television, time constraints. Hope to talk to you another time in the future.
Thank you so much for having me, and do read about the report at homeless.org.za. It is on our website, and you can download the full report and the findings in the next couple of days.
Awesome. Sam Force is with the U-turn, and he's the director. They collaborated with other NGOs to put out that report. I think it's quite an important one.